Welcome to today's webinar titled, What is TRICARE for Life? We are thrilled to have with us today Ann Breslin. She is the TRICARE for Life Program Manager at the Defense Health Agency. Without further delay, I will turn things over to Ann Breslin.
Thanks, Terry. Good morning or good afternoon, depending on where you are. Welcome to today's webinar. As Terry said, my name is Ann Breslin, and I serve as the TRICARE for Life Program Manager. And I know we have many people out there listening, so I hope you find this to be helpful to you in navigating the next steps in your TRICARE coverage. So let's get started with what is TRICARE for Life. Before I get into the details of this presentation, I will read the disclaimer, which is on page 2. The appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, or services contained therein. For other than authorized activities, such as military exchanges and morale, welfare, and recreation sites, the Department of Defense does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this Department of Defense sponsored webinar. On page 3 is our agenda. So today I'm going to help you understand or learn about what TRICARE for Life is, what Medicare Part A and B is and why it's important to your continued TRICARE coverage, Medicare eligibility and how you enroll in Medicare, how you get care using these two programs and what your cost might be, and how you get your claims processed, and when you have questions, where you can go to get customer service. In addition, we'll cover how TRICARE for Life works with other health insurance and provide you resources that you can refer to when you have additional questions that may come up. On page 4, what is TRICARE for Life? So TRICARE for Life serves as a Medicare wraparound coverage for TRICARE beneficiaries. In order for the beneficiaries to participate in this program, they must have both Medicare Part A and Medicare Part B, and that is regardless of age or residence. So obviously, if you're not eligible for Medicare, you don't have to have these things, but you can become eligible based on age or based on some health condition or disability. So if that happens, you do need Part A and Part B. So to participate in TRICARE for Life, there is no enrollment form. Unlike many of our other programs, there's no enrollment form and there are no enrollment fees. The premiums that you do have to pay are those associated with Medicare Part B. There is a monthly premium and it is based on income. There is a whole scale which is available on the Medicare.gov site, also on the SSA.gov site. I can tell you that the base premium for Medicare Part B in 2020 is $144.60, and the maximum premium for those making filing jointly and making over $750,000, they can pay up to $491.60 a month. The TRICARE for Life program is a worldwide benefit, and TRICARE pays secondary to Medicare, both in the United States and the U.S. territories. For individuals who live outside the U.S. territories or the continental United States, Medicare does not pay, so TRICARE would be the primary payer. I often get questions about one member of a family becoming entitled to Medicare and how does it affect the other members of the family. The fact is it doesn't affect the other members of the family. It's an individual entitlement to Medicare. So if one member of the family is turning 65 and the spouse is not yet 65, the individual turning 65 will need to sign up for Medicare, have Medicare A and B, and they would then be covered under the program called TRICARE for Life. if there's just one other family member enrolled in Prime, for example, prior to the other member becoming entitled to Medicare, once the individual does become entitled to Medicare, the enrollment fees are reduced to the individual enrollment fee. If there are children in the family, so there was be a spouse along with children, that family enrollment fee would continue. Since we now have what we call TRICARE qualifying life events, a member of a family turning 65 is a qualifying life event, and therefore the other family members who may have been in Prime have the option to switch to Select or vice versa, depending on what they prefer. So they can stay where they are, or they have the option to switch. Information on qualifying life events is available on our TRICARE website at tricare.mil/life events. One of the most important things each TRICARE beneficiary can do is to maintain their contact information in DEARS. Keep it up to date, because we do send out a notice to each and every person 5 months in advance of their 65th birthday. And if we have your wrong address, you are not going to get that information. We also will use email if you've opted into electronic communications. So I know people, don't always keep the same email address or may have multiple ones. Some may check more often than others. Please update your email address if you would like electronic communications. Phone numbers as well are very helpful for us to reach out to you when we need to share information. So what is Medicare Part A and Medicare Part B? Medicare Part A is referred to as hospital insurance, and it covers not just care in a hospital, but in other inpatient facilities. Hospice care, which could be inpatient or provided in your home, and as well as some other home health care. Part A, we each pay into that program when we're working, so it's a payroll tax that is paid for. So when you turn 65, you're not going to be paying additional monies toward Part A unless you continue to work. For Medicare Part B, that is a monthly premium that we each pay. If you're receiving a Social Security retirement check or a disability check, the Part B premium will be taken out of those checks. Now, as you may know, the retirement age for collecting Social Security continues to increase each year up to, I think it goes up to age 67. So the earliest you can get it is 62, and then some people will have to wait to 67 based on their birth date. So if you're turning 65 and you are not collecting Social Security, you will receive a bill from Medicare on a quarterly basis to pay those premiums. You must pay those premiums. Failure to pay will mean loss of your TRICARE coverage. So pay attention to your mail and make sure you take care of those premiums. We have a note at the bottom of this slide 6, which refers to Medicare Part D, which is D as in dog, and that's Medicare prescription drug coverage. I generally tell the TRICARE population that this is, 1, not required, and 2, not necessary, given that you have comprehensive prescription drug coverage regardless of which TRICARE plan you are in, including TRICARE for Life. There is a subset of the population where this is something that you want to have, and that is individuals who are low income. And the reason it's important for these individuals is, 1, they qualify for extra help, which means that their premiums are paid for. So they get duplicate prescription drug coverage without having to pay additional monies for it. Oftentimes, individuals with low income are automatically enrolled in that program, and so please keep it if you qualify for that extra help. So a lot of what I've talked about so far is individuals who are eligible for Medicare when they turn 65. That that's a fortunate group that doesn't become eligible before 65. But there are others who, due to disability or health conditions such as end-stage renal disease or Lou Gehrig's or mesothelioma, which is an asbestos-related illness, qualify regardless of their age. And in particular for disability, those individuals, after receiving Social Security disability insurance payments on a monthly basis for 25 months, they're awarded Medicare, both Medicare Part A and Medicare Part B as in boy. And so those individuals need to keep that coverage to remain eligible for TRICARE. Let's see. On our TRICARE website, tricare.mil/publications, you can find the TRICARE and Medicare Under 65 brochure. It's also available on the homepage for TRICARE for Life, which is tricare.mil/TFL, the acronym for TRICARE for Life. So for those individuals turning 65, when can you sign up for Medicare? So it's based on your actual birth date, the month, the year, and the day. If your birthday, actually, let's go back a bit, sorry. 5 months before your 60th birthday, you will receive a notice, or at least it will be sent. If your information is accurate in DEERS, you should receive it. TRICARE coverage will start the first day, the TRICARE for Life coverage will start the first day that both your Part A and Part B coverage is in effect. And those dates will vary if you delay your enrollment. So I'm going to get into the specifics of when you need to sign up based on your birth date. So each of us have what's called an initial enrollment period. And that enrollment period is a 7-month window in which we can sign up for Medicare Part A and Part B. So if your birthday happens to fall on the first day of the month, you actually become eligible for Medicare the month prior. So if your birthday is February 1st, your coverage began, or you were eligible January 1st. So you need to sign up before January, or you're going to have a gap in your coverage. You need to sign up at no later than 2 months before your birth month, if your birthday is the first of the month. If your birthday is on any other day of the month, you can sign up just the month before, because your Medicare coverage will begin the month you turn 65, on the first of that month, not on your birth date. So if your birthday is July 22nd, your coverage will be July 1st. So you need to sign up no later than June 30th. I recommend starting earlier. You have 3 months before then to start. So I'm on slide 9, and then on the bottom of that page, there is a link to the 65 brochure, which gets into all the nitty-gritty details of when you sign up based on various scenarios. So it's tricare.mil/publications. So if by some chance you didn't get the message that TRICARE requires you to have Medicare when you turn 65, and you totally miss your initial enrollment period, you have the option to sign up during what Medicare calls the general enrollment period. Excuse me. The general enrollment period occurs each and every year, January 1st through March 31st. Unfortunately, the coverage is not effective until July 1st. So let me say one further thing. If you missed your initial enrollment period, you could probably still sign up for Part A, because A can be awarded retroactively up to 6 months. But the general enrollment period is for Part B, and it will be not effective until July 1st. But keep in mind that if you have Part A only, for any period of time, you'll have no TRICARE coverage. The open season, the TRICARE open season, is not applicable to TRICARE for Life. TRICARE for Life is not an enrollment program, and TRICARE for Life is, as I said previously, effective upon the first date that you have both Medicare Part A and Medicare Part B. In addition, with respect to the general enrollment period, if you waited more than 12 months, if it's been more than 12 months since you were eligible for Medicare, Medicare will assess a 10% higher premium for each 12 months that you could have had Medicare but did not. I'm now on slide 11, and this is about the special enrollment period. The special enrollment period that Medicare offers pertains to individuals who are either working or their spouse is working, and they're covered by employer-sponsored coverage based on that current employment. Medicare allows individuals who have employer-sponsored coverage based on current employment to delay enrollment in Medicare Part B, and they're not subject to that higher premium for enrolling late. That's all well and good, and that's nice to have that choice, but without Part B at age 65, you will not have your TRICARE coverage. So you have a choice of relying on your employer-sponsored coverage or having your employer-sponsored coverage, Medicare, and TRICARE. Keep in mind that Part B premiums are based on income. So if you choose to have all three while you're working, you're going to pay a higher amount for that Part B premium. It might make sense to rely on that employer-sponsored coverage until you know that you're either going to retire, lose employment, or lose that employer-sponsored coverage. The special enrollment period is available to you anytime while covered or working, covered by the employer-sponsored coverage while working, or within the first 8 months following the loss of that employment or the employer-sponsored coverage, whichever occurs first. So if you know you're going to retire, what you want to do is you want to sign up for Part B the month before you do that. That way you wouldn't have a break between your employer coverage and TRICARE for Life coverage. If you wait to file for Medicare in those months, 8 months following the loss of the employment or coverage, you will have a gap in your TRICARE coverage because your Part B will not begin right away. There's at least a month. There's a month gap. Slide 12. How do you get care? So we don't issue a TRICARE for Life card. What you need as proof of your coverage is your Medicare health insurance card, along with your military ID card. Your Medicare card will need to show that you have Part A and Part B as in boy, and the effective dates are listed on that card. Once you get that Medicare card, you want to take it to your ID card facility because your military ID card will be expiring, and you need to, on the back side, it will need to say civilian care yes. And you'll need to present that Medicare card in order to get the military ID card updated so that your claims will be processed. And what will happen is the claims will be processed by Medicare first and TRICARE second, if those are your only two insurances. If for some reason you lose your Medicare card, you can contact the Social Security Administration at 1-800-772-1213 or visit their website, socialsecurity.gov. So Medicare has a little different terminology for providers. They have Medicare participating and Medicare non-participating providers. Participating providers agree to accept the Medicare allowable amount as payment in full. the non-participating providers are allowed to bill 15% above that amount. Not to worry, TRICARE picks up that difference, so it's no different cost for you to see either a Medicare participating or Medicare non-participating provider. Opt-out providers is a whole different story. These are providers who do not want to participate in the Medicare program, and they intentionally opt out of the program. So they cannot bill Medicare, and Medicare will not pay them for any care provided. So you need to know up front if you're seeing a provider of this type, and if so, find out what it's going to cost you, because TRICARE will pay up to 20% of the TRICARE allowable amount, and you will be responsible for the remaining billed charges, not what TRICARE's allowed amount was or what Medicare's allowed amount was. So that can be a significant expense. So very important to be aware. You may also receive care at military hospitals and clinics on a space available basis. Some of you may also be eligible for care at the Department of Veterans Affairs. Now, keep in mind that the VA facilities cannot bill Medicare. This would be considered duplicate government payment. So Medicare can't pay for care received in the veterans facilities. If you have service-connected conditions or conditions, use your VA benefits for that. But for non-service connected care, I strongly recommend that you go outside of the VA and use civilian providers, because when the care you receive is covered by both Medicare and TRICARE, you will have no out-of-pocket expenses. Slide 14. I have a couple of cost examples for you. On the left, Mr. Jones gets care from a Medicare participating or non-participating provider. This provider happened to bill $1,000, and Medicare allowed $400. Medicare is going to pay 80% of that $400, which is $320, and TRICARE will pay that remaining 20% or $80, leaving Mr. Jones with no financial liability. On the right side, Mr. Jones gets non-service connected care from a VA doctor or hospital. The bill is $1,000. TRICARE's allowable amount is $400. Medicare is not going to pay. As I mentioned, Medicare cannot pay a VA facility. TRICARE pays 20% of that $400, leaving Mr. Jones with $320. So this is just a clear-cut example of what you'd have to pay if you chose to use the VA for non-service connected care, and why it would be to your benefit to see a Medicare civilian provider. On the bottom of slide 14 are links to TRICARE costs at tricare.mil/costs, and specifically the TRICARE for Life, tricare.mil/TFL. So it would be very time-consuming and more than I'm capable. I don't have a clinical background. I could not tell you all the ins and outs and specifics of medical coverage. TRICARE covers proven medically necessary and appropriate care. On our website, tricare.mil/covered services, you can search on a particular service that you or your doctor have your doctor's advised you that you need to determine if it is covered. You can do this similarly. You can do this on the Medicare site, medicare.gov. There are some things that are clearly not covered by TRICARE or Medicare, including long-term care. Long-term care is custodial care or things like activities of daily living, help dressing, bathing, eating, walking. Those are long-term care issues, and those are covered specifically through long-term care insurance. Acupuncture is not a covered benefit. Experimental and investigational services are not covered. Routine eye exams are not covered. Cosmetic surgery is another. This is not all-inclusive. This just is to give you a general sense of what is or isn't covered and where you can find additional information. On slide 16, there's a chart here to help you understand when you may have out-of-pocket expenses. So on the far left, we list types of service. So if the care on the first line is covered by TRICARE and Medicare, Medicare will pay their allowed amount. TRICARE is going to pay the remaining amount. And you'll have no out-of-pocket expenses, as was described on a previous slide. If it's covered only by Medicare, Medicare is going to pay their allowed amount, and TRICARE is not going to pay anything because it's not a TRICARE benefit. And at that point, you'd be responsible for the Medicare annual deductible and cost share. If it's only covered by TRICARE, Medicare will pay nothing. TRICARE is going to pay their allowable amount, and then you'll be responsible for the TRICARE deductible and cost share. If you receive one of these non-covered services that I mentioned, you would be responsible for 100% of the billed charges. So for TRICARE for Life, there are two contractors that provide customer service and claims processing. One covers the United States and its territories, and the other is for overseas. And their contact information and websites are provided on slide 17. TRICARE4U.com is for stateside and territories, and their direct number is 866-773-0404. For overseas, it's International SOS. Their website is TRICARE-overseas.com, where you can get additional information. So in most cases, your providers are going to file claims for you directly with Medicare, as that's primary to TRICARE. Medicare is going to pay its portion, and then they're going to forward that claim electronically to our claims processor. And as I said, if it's covered by both Medicare and TRICARE, you'll have no out-of-pocket expenses. And when it's covered by one or the other, you will have some co-payments or deductible to pay. There are situations where the provider is well aware that Medicare doesn't cover a service, and in that situation, they can bill TRICARE directly, file their claim directly with TRICARE, and not file with Medicare. All claims are to be filed within 1 year of the date of service or the date of an inpatient discharge. Claim forms are available on our website, tricare.mil/claims, or also on the contractor's site, TRICARE4U.com. TRICARE is the primary payer for care received overseas, unless you have other health insurance. And as I mentioned previously, Medicare will not pay for care received overseas. You will need to file those claims yourself with the overseas contractor, and there are various documents to prove payment, because generally you have to pay up front for care received overseas. It could be a credit card receipt, a canceled check, credit card statement, invoice from the provider that shows he or she has been paid. Overseas claims are to be filed within 3 years of the date of service or date of discharge. And again, for more information on overseas claims or care, go to tricare-overseas.com. So there are some folks who will have more than just TRICARE and Medicare. They may have other health insurance from their employer. And in this case, that employer-sponsored coverage is the primary insurance. Your provider will file with the primary insurance. Excuse me. Medicare is going to pay second, and TRICARE will pay last. If you have other health insurance that isn't based on current employment, Medicare is the first payer, the OH high is the second payer, and TRICARE pays last. Now, what's important to note here is that Medicare will only forward your claim to one other insurance. So if Medicare is paying first, they file the claim with the other health insurance after they've processed and paid. And so in order for, if there's any remaining liability, in order for TRICARE to process that claim, you, the patient, are required to file that claim with TRICARE. And there is specific information on the TRICAREforyou.com website on what is required to file that claim. The DD 2642, your provider's itemized bill, the Medicare summary notice, an EOB from the other health insurance. So you can go to that website to clarify. You can set up an account on the TRICARE For You site so that you can file claims and look at the status of claims on that website. On slide 21 is a contact list. So if you're using a cell phone, you might want to put all these in or put them on your bulletin board next to your phone, whatever is easy for you. We have the TRICARE For Life Wisconsin Physician Service contractor, phone numbers and website, the International SOS phone numbers, website, no phone number, for overseas. Defense Manpower Data Center manages DEERS, the Defense Enrollment Eligibility Reporting System. That is where you can update your personal information to make sure you get all the important communication. And then we also have the Social Security and Medicare information. And the last one is the Office of Personnel Management. I'll just briefly note that many military retirees have second careers as federal civilian servants, and so civil servants. And so they also are eligible for the Federal Employee Health Benefit Program. Some don't choose to have it because they have good care and coverage under TRICARE. One suggestion is you have the option of having the Federal Employee Health Benefit Program in the last year of your employment as a federal civil servant. And you can either suspend it upon retirement or keep it, your choice. And if you suspend it, not terminate it, if you suspend it using a form called the R79, you can re-enroll in FEHBP if you so choose at a future date during the open season. So it's just an option. Additional information is available on that opm.gov site. On slide 22 are some of the resources I referenced, the two brochures in the middle, specifically in the cost matrix. The first one is the TRICARE For Life Handbook, which has the contact information and other frequently asked questions and other helpful program information. So if you don't have Medicare yet, and the two documents in the middle are your that's your Bible to get it right, to get your Medicare coverage. I thank you for listening, and I apologize for my raspy throat and cough. I am now available to take questions.
Okay, thank you very much, Anne. And we do have some questions here. Our first question is, as a surviving spouse, I have Medicare and TRICARE For Life for my health coverage. Is there full or partial coverage for hearing aids?
Hearing aids are not a benefit of the Medicare or TRICARE programs. However, you may be able to obtain hearing aids through other government programs. This includes the Department of Veterans Affairs and the Retiree at Cost Hearing Aid Program. The website for this is militaryaudiology.org/RACHAP hyphen RHAPP hyphen locations. So it's not offered at every military facility. There's some that do and some that don't, and it's specific to the retiree. It is not available to dependents. And that concludes my response to that question.
Great. Thank you, Ann. Next question. I turned 65 this year. I'll be working for a few more years and will have OHI. Once I retire and start Medicare Part B, will I have access to TFL? Will I continue to have access to TRICARE Select until then?
So as I mentioned during my presentation, if you continue to work and do not elect to enroll in Part B, you will not have access to TRICARE For Life or any other TRICARE programs. You would rely on that employer-sponsored coverage. And as I also mentioned, there's a special enrollment period so that someone in this circumstance would not have to pay a higher premium, and they have up to 8 months following their loss of employment or coverage to enroll in Part B, but enroll before you lose it so that you have no gap. And at that point, yes, you would have TRICARE For Life. Next question.
Great, thanks, Ann. Next, if I choose to continue medical coverage with Blue Cross Blue Shield, when I turn 65 instead of enrolling in Medicare, what happens to my TRICARE coverage?
So if you don't enroll in Medicare and you reach your 65th birthday, you will be terminated from your current TRICARE plan and will not have coverage until you have Medicare Part A and Part B. Next question.
Okay. This question relates to how they can add the Silver Sneakers gym membership supplemental coverage to their Medicare program without deactivating TRICARE For Life coverage. Is it possible to add a Medicare supplement plan to their coverage and still remain TFL?
So for those of you who don't know, Silver Sneakers is a gym membership which is offered as an added benefit for enrolling in some Medicare Advantage plans. Now, these Medicare Advantage plans are not Medicare supplements. Medicare Advantage plans are required to provide all Medicare benefits under the A and B, as in boy. Many of them also offer the drug benefit, Part D. So you may enroll in an MA plan, a Medicare Advantage plan. I don't believe there is a clear advantage for a TRICARE beneficiary entitled to Medicare to enroll in an MA plan. Most MA plans have a monthly premium in addition to your Medicare Part B premium. Some also have a premium associated with the prescription drug coverage. In addition to monthly premiums, enrollees in a Medicare Advantage plan also have co-payments for the various services they receive. TRICARE can reimburse for co-payments associated with TRICARE covered services. However, the beneficiary will have to file claims for reimbursement. If you enroll in a Medicare Advantage plan, you must receive all care with the exception of emergency services from the Medicare Advantage plan's network of providers. Medicare Advantage plan enrollees must exhaust their Medicare prescription drug benefit before using the TRICARE pharmacy benefit. In contrast, TRICARE For Life beneficiaries do not have enrollment fees or monthly premiums, with the exception of Medicare Part B premiums. TRICARE For Life beneficiaries have prescription drug coverage with no monthly premium. TRICARE For Life beneficiaries can self-refer to Medicare participating or non-participating providers, including specialists. TRICARE For Life beneficiaries do not have to file claims unless they have other health insurance in addition to Medicare. When care received is covered by Medicare and TRICARE, TRICARE For Life beneficiaries have no out-of-pocket expenses. Gym memberships and gym equipment are not TRICARE covered benefits as they are specifically excluded by law. Many military fitness centers are available to retirees and their eligible family members. So I gave you a lot of information there. In a nutshell, if you want Silver Sneakers, you have to sign up for paying premiums. You have to sign up for being told which providers you can see. And yes, you might get a gym membership, but I'm not sure it's worth it. That's a personal choice you would have to make. And that concludes my response to that question.
Great, thanks, Ann. Next question. I just turned 65, and it appears I have to sign up for Medicare Part A and B to continue receiving TRICARE. I'm still employed, and my company provides a complete medical insurance program. Do I still have to have Medicare Part B to keep TRICARE?
Yes, I think we kind of covered this pretty well in the presentation. You cannot have TRICARE continued coverage at the age of 65 without Medicare Part A and B. I should say one exception here, which I believe I did not cover in the presentation. So there's two exceptions. That's if you are active duty or an active duty family member. That's an important exceptions. Those individuals are not required to have Part B upon age 65. And that information is covered in our handbook and in the brochures that I referenced. So this individual plans to continue working. They will not have continued TRICARE coverage without the Part B. You can rely on your employer-sponsored coverage, or you can sign up for B. But again, as I mentioned, it's based on income, and so you will probably pay a higher premium because you're working and earning more money than you would otherwise. The Part B late enrollment premium surcharge is waived if you choose to delay and rely on your employer-sponsored coverage. You will need documentation from your employer to take advantage of that special enrollment period, which waives that higher premium. Next question.
Okay. I am a retired Air Force colonel living in Germany. How does TRICARE for Life affect those of us living in Europe? What do we need to do to enroll, and how do we use TRICARE overseas or TRICARE for Life once we turn 65 years old?
So there are no enrollment forms or enrollment fees for TRICARE for Life. TRICARE for Life coverage is automatically effective the first date that you have Medicare Part A and Part B, and that's regardless of where you live. Sign up for Medicare no later than 2 months before the month you turn 65. That's my general guidance, so that covers your scenario regardless of your birth date. Sign up no later than 2 months before the month you turn 65. This will ensure that your Medicare Part A and B coverage begin on the same day, and this will eliminate the possibility of a break in your TRICARE coverage. You can sign up for Medicare on the Social Security website, so you don't have to be in the States and go to a Social Security office. And I believe I provided all the information relative to overseas filing claims, etc. And again, refer to our website for more details. Next question.
Great, thanks. Are retired Army National Guard retirees and their spouses with over total active and reserve service over 30 years eligible for TRICARE for Life when they are 65 years old?
Yes, Army National Guard retirees in receipt of retired pay with 20 years or more of service are medically retired are eligible for TRICARE for Life when they have Medicare Part A and Part B. Next question.
Okay. TRICARE for Life is a supplemental Medicare plan. Why is TRICARE for Life better than other Medicare supplemental plans available on the market?
So for one, there are no enrollment forms, no enrollment fees, and no monthly premiums for TRICARE for Life. TFL, TRICARE for Life, is automatically effective the first date both your Medicare Part A and Part B coverage is effective. In addition, based on where you live, like you would have to go into the Medicare.gov site, type in your zip code to determine which Medigap plans are available in your area. It's very complex. I've helped a lot of people, personal friends, in the last year try to make decisions on what Medigap plans would be best for them. So you're welcome to look at it, but you're going to pay some significant premiums based on what they cover. And you're welcome to make a choice, but this one is free. So that would be my choice. Next question.
Great. Thanks, Ann. My wife and I have been paying for TRICARE Prime yearly, but since I will turn 65 in July, I only paid for 6 months this year. Since my wife won't be 65 until August, how can we pay for 1 month for just her? Will we be able to continue getting our prescriptions at our local Air Force base?
Please contact your regional contractor to make arrangements to pay the enrollment fee for the month of July for your wife. As a TFL beneficiary, you may continue getting your prescriptions filled at your local Air Force base. Next question.
Okay. Next question is, can you please discuss how TRICARE for Life works with other Medicare Advantage plans?
So I covered that in a previous question, but I'll just summarize that TRICARE for Life will pay for the co-payments. TRICARE for Life does not pay for the premiums associated with the Medicare Advantage plan enrollment. And in order to be reimbursed for those co-payments, the individual would have to file a claim with the TRICARE for Life contractor, which is Wisconsin Physician Service. So it becomes a little bit of an administrative burden, but TRICARE will pay those co-payments if the care received is covered by TRICARE and the claim is filed. Next question.
Okay. Are there any exercise programs available under TRICARE for Life?
TRICARE in general, including TRICARE for Life, does not cover gym memberships or exercise programs. If you live near a military facility, you may be able to use the gyms there. Many offer that access to the gyms to retirees and their eligible family members. Next question.
Okay. I am still working and plan to continue for at least 3 years after I turn 65. Can I continue with TRICARE instead of signing up for Medicare? I don't have the extra money to pay for Medicare every month.
So without Medicare, you cannot continue TRICARE at the age of 65 unless you're active duty or married to someone who is active duty. So, as previously discussed, you may continue with your employer-sponsored coverage and sign up for Medicare Part B the month before you retire from that position where you have employer coverage. Next question.
Okay. Does having another Medicare Advantage plan in any effect the Commander's TRICARE Plus program, i.e., can it be used as a criterion for exclusion from the direct healthcare system?
Yes, it can be used to exclude you from direct care, and that is because the Medicare Advantage plan receives the capitation, which is a payment for all medically necessary Medicare-covered benefits directly from the Centers for Medicare and Medicaid Service. So they receive a specific dollar amount for each enrollee to cover that care. If you were then to go to a direct care facility, the government is paying twice for your care. That's duplicate, what we call duplicate government payment, which is not permitted. And so, yes, you can be excluded for enrolling in a Medicare Advantage plan. Thank you. Next question.
Sure. If I have a Medicare Advantage plan and TFL and go out of network for care, will TFL still remain the third payer?
So, I don't know who the three payers are here. So if you have Medicare Advantage, you're not using original Medicare. And that Medicare Advantage plan has to cover all your care. And you have to follow the rules of that primary insurer, which sounds like it's that Medicare Advantage plan. If you choose not to follow the plan rules, you will be stuck paying that bill. TRICARE is not going to pay the bill. You have to follow the plan rules, and the only thing that TRICARE can pay are the co-payments for TRICARE covered services. Next question.
Thank you, Ann. Referencing page 5, what is a TRICARE eligible beneficiary? Is a non-military spouse a TFL eligible beneficiary?
Okay, so there's a lot. Oh my gosh, it's very complicated to determine who all the TRICARE beneficiaries are. It's all the uniformed services and their eligible dependents. There's rules about if you separate from your spouse and you weren't married for 20 years while the service member served 20 years, you wouldn't qualify for continued care. Or if you did meet that requirement, you would qualify unless you remarried, then you're no longer qualified. So if you're covered by TRICARE today, most likely you're going to be covered in the future. But again, if there's a separation and you didn't meet the 2020 rule, etc., there are exceptions where you wouldn't be covered. So my recommendation is to go to tricare.mil/eligibility, where you can get specifics on who's covered for TRICARE and who's not. In addition, your eligibility is maintained in the Defense Enrollment Eligibility Reporting System, DEERS, and their contact information is also included in our briefing slides. Next question.
Okay. How do we know the computer systems really automatically enrolled us? Will we get a letter or announcement welcoming us to TFL?
There is not a welcome letter to TRICARE for Life. What happens is we share data with Medicare every week, and our files are matched with Medicare enrollment files, and then that information comes back to the Defense Manpower Data Center that manages the Defense Enrollment Eligibility Reporting System where entitlement is maintained. So when you go to the doctor and you present your Medicare card and your military ID card, they know they're to bill Medicare, and then it automatically comes over for TRICARE to pay TRICARE's portion of the claim. You will receive what's called an explanation of benefits from Wisconsin Physician Service, the current TRICARE for Life contractor, and you will see what was billed, what was allowed by Medicare, how much Medicare paid, what TRICARE paid, or what they didn't pay, and what amount, if any, you owe. And as I mentioned, if it's covered by both, you're going to owe nothing. So you won't get a notice in the mail. You'll get an EOB once you've accessed care that will clearly inform you that your continued TRICARE coverage. Next question.
Okay. Once Medicare pays first, do they automatically send remaining balance to TFL?
They do, provided there's no other health insurance involved. If there's other health insurance, it's going to go to the other health insurance. And then when you receive an explanation of benefits from the other health insurance, you know if there's any remaining amount that you then would have to file a claim with TRICARE, WPS/TFL, TRICARE for Life, for any reimbursement. Next question.
Okay, I am retired. My spouse will turn 65 prior to me. Would he need to get a new ID card for the TFL once he enrolls in Medicare Parts A and B?
Yes, you'll need to get a new military ID card. You can present your Medicare card to the ID card facility, and when you get the new card, on the back it should say civilian yes, which means you're eligible for continued care outside the MTF. Next question.
What if someone has a dependent that is disabled? Do they become TRICARE for Life at same time as sponsor?
The disabled individual under the age of 65, if they are collecting Social Security and entitled to Medicare, they are eligible for TFL as soon as they have A and B. So the under 65 with Medicare are allowed to continue enrollment in TRICARE Prime. They're not eligible to be in TRICARE Select, but they could just use TRICARE for Life. They don't have to use TRICARE Prime. So I think I've answered the question. Next one. Terry, are there any more questions?
Yes, I'm sorry about that. We have a couple minutes left. What question do you ask a provider to make sure you are covered?
So the providers are not your best source for whether or not you're covered. You need to look at your ID card. Does it say civilian yes on the back? And do you have a Medicare card that shows Medicare A and B? If you have those two cards with that information, you're a covered TRICARE beneficiary. Now keep in mind, you must continue to pay your Part B premiums. If you stop paying those Part B premiums and you still have that old card that says A and B, but you have a new card that says A only, and you present the A and B card, you don't have coverage. And you'll end up with that bill. So keep paying for your Part B, present your Medicare card that is accurate, and your military ID card. DEERS is the system of record, and so if you really want to validate your coverage, that's where you do it. Their contact information has been provided in the briefing slides. Next question.
And we have time for one more, Ann. Thanks so much. What about dental coverage? Is there any dental coverage?
So, was it last year or the year before? FEDVIP, Federal Employee Dental Vision Insurance Program, which was previously only for federal civil servants. I actually helped implement this program for many TRICARE beneficiaries. It's not for all yet, but definitely for retirees, definitely for TRICARE for Life beneficiaries. If you're interested in dental or vision insurance, you are eligible for the coverage under the federal program, and information is available at benefeds.com. It's BENEFEDS.com. OPM administers that program, and it's not a Department of Defense program. So you can also go to the Office of Personnel Management site, opm.gov. It would also refer you to BenFeds. Thank you very much for your participation.
Okay, thank you so much, Ann. And I really want to thank Ann Breslin for sharing her invaluable experience and expertise. I would also like to thank our attendees for participating in today's webinar. If we didn't answer your questions today, please refer to the contact information in your copy of the webinar slide deck. And also, you can find many of the answers to questions about TRICARE on the TRICARE website at tricare.mil. This concludes today's webinar on what is TRICARE for Life. Thank you.